So why invest in drug education and prevention? It seems like it's a standard understanding. People will think, yeah, it's important, so why isn't it done? It's important because adolescence is a peak time and it's a period for the development of substance use problems and disorders. It's often seen that it's during this age period that initiation of substance use begins, and also misuse often occurs in this time period. Now, we know that earlier initiation of drug and alcohol use is related to more negative outcomes, from poor school performance, early dropout, to increased risk of dependency and mental illness in adulthood. We also know that early prevention and treatment and intervention can help in that process and can change that trajectory. So those are kind of known evaluated outcomes that we have seen. So prevention is key. Now, what aspects of prevention can be done? So educating individuals to understand the harms and the risks, and also build resilience prior to harmful exposure or high risk behaviors and excessive use. I mean, we do know that adolescence is a time of experimentation as well. So it's not an abstinence-based prevention approach. It really is understanding that use will probably be there, experimentation will probably happen, but that's not the problem. I think it's when individuals understand what is more high risk behavior, and if it interacts with other mental health issues that are not being addressed, and substance use is kind of used in place of addressing the mental illness adequately, then that's when intervention is needed, and prevention is quite important at that point. Another important aspect of having prevention in place is that we are all quite aware that we have an overdose crisis. Awareness of overdose and the risks for overdose, signs of an overdose, and how to address that for every individual, every youth is important, and how to manage their risk. That's another aspect of how prevention can really save lives. So we all understand that adolescence is a kind of a vulnerable period. And we know from a lot of different neurodevelopmental studies that they've demonstrated early life adversity can have quite significant changes to how the brain develops, how the brain responds to stress, and how the brain responds to reward as well, what it finds rewarding, and how it modifies that system can be affected by early life adversity. The type of adversity, when it occurs, how often, and the severity, of course. And you see from this graph, there's pretty much arrows going every way, kind of crossing through everything. It's really just to emphasize the interaction between all these different systems and everything that's going on during development in the brain. And then also many sex differences and genetic predispositions that exist in an individual interact with how the person and their body responds to this adversity. The genetic predispositions also sometimes dictate how the reward and the stress system works, and how endogenous stress hormones and reward systems are already predetermined and programmed. Then there are also a lot of environmental and risk factors that interact with how the system is responding, and that can lead to the excessive use of drugs, and also how drugs are experienced, the amount of pleasure and desire that's there, how habits are formed, how negative affect and the system responds by self-medicating, and also it can lead to some diminished cognitive control as well. Now, speaking about the vulnerability of this time period of one's life, it's also quite important, I think, to emphasize the resilience and the adaptability of the system, that despite the significant early life adversities, there's a very powerful way that the brain and the body can rebound and can adapt and can still function at a thriving kind of mode and level. So that's why I think we have to understand the importance of how this period is vulnerable, but also have a lot of hope in that this period is very resilient and adaptable and plastic. So prevention does need to occur early. I think the earlier, the better. And school is the ideal location because at that age period, people do spend approximately 25% of their waking lives in school, either in classes or among peers. And the time to first start experimenting with substance use is also during this period and among their peers as well at school. Education can prevent harmful exposure, and there's a lot of messaging that can be done within the school environment that can tailor it to the specific developmental levels of the students. There's also possibility of targeted prevention because in the school system, there is repeated daily interactions, and those at higher risk can be targeted for early intervention. Also think that it's important to move beyond thinking about crisis intervention in terms of substance use. So yes, targeted prevention for those who are vulnerable is important, but beyond that point, I think a broad-based prevention is also very effective. We have a partnership with the Vancouver School Board, and from their substance use kind of targeted prevention program, they do also have expressed the changing landscape within the school system, and things that students are exposed to have been fluctuating quite a bit. Vaping has become very popular in recent years, and that's something that new that they've seen, and teachers and educators weren't necessarily equipped or kind of expecting that to become so popular, and how to address its risks and understanding among students. Cannabis was also legalized, and that led to a lot of questions and education that was required for the students. Binge drinking is still an issue among high school students, and we are still in the midst of an overdose crisis that I think the education and information that is conveyed to students is quite limited. And sometimes completely lacking, that all they hear about it is maybe from social media rather than coming from educators. I see a hand up from Mukesh. I'm happy to take a pause after the slide for your question. Just the last point I wanted to make was overlaying on top of all these items that have been changing amongst the students' lives is COVID-19, of course, and all the struggles that have come along with it. Yes, Mukesh. Would you like to share your question?
Yeah, I have two questions. I threw one into the chat, but the second one's a follow-up to it. So what kind of population are you looking at when you're targeting, like what are you targeting for prevention? Like right now, my youth, for example, are youth that are at risk for gangs, so their experimentation of substances is a norm to them. So it falls more into the intervention line, but what kind of language would you use to discuss this with that population?
Yeah, so in terms of the material, so we have broad-based, I think, prevention and information that is required for everyone at different trajectories of risk in terms of needing the information, needing to understand overdose, recognizing symptoms, of course, but then understanding the risks and interactions with mental health issues, that would probably be one subpopulation. If you're mentioning with the youth that you're working with in gang-related activities, that would be another domain and another content that would need to be developed to address that with them. But I think in the underlying levels of substance use and understanding the harms related to it can apply to those in all walks. Does that address your question, Mukesh?
Thank you.
Okay, great. And I'm sorry, I think I'm in the full screen mode, so my chat box is really small in the bottom, so I don't get them popping up. So I think I'll have to check on those later. So maybe I think if you raise your hand, that would be easier for those who have further questions. Or Michael, if you can see the chat box, you can help me out.
Yes.
Okay, so broad-based prevention programs. Going back, I think the ones that some of us may remember is the Say No to Drugs campaign. This is probably the prevention programs that have kind of been more broad-based, and definitely scare tactics and messaging like this have shown just not to be very effective. I mean, we remember them as a messaging, but I don't know in terms of how it's affecting behavior or has changed the likelihood of using substances is very minimal. It has moved on. I think these are more pictures from the 80s maybe, and then into the 90s, 2000, it changed. So you can see that the prevention campaigns have been similar, like pretty much posters and putting them up in schools and the hallways. And it moved from that to like this, a little bit more like scare tactics, sort of hoping that just by youth seeing this, it would change how they feel about substance use. And I think we're aware and educators know that this really doesn't have many positive and significant effects. So then, knowing this, what would be the best way to target youth within the school system? So as we thought about developing the shortcut concept, we looked to evidence from other examples and other interventions and programs that have been developed. There were quite a few reviews that look at effectiveness of school-based prevention interventions, and picking out what are the main factors and variables that significantly change students, either their impressions about substance use or actually changing their behavior to either initiate or to move from experimentation to more harmful patterns of use. So from some programs, they've identified that when the program is part of the curriculum, so when there's more information, it's not really just a picture, a poster, or inviting, for example, law enforcement to come and give a 1-hour seminar, that's not as effective. But when it's something that's integrated into the curriculum, when the educators are involved in conveying the information, and when peers are also supporting one another, and so a peer-based program, a peer teaching method, those are factors that do make a program more effective. So that social influence piece has been found to be quite significant. So the Vancouver School Board system has a peer-based program, but not a universal school-based prevention program. So we looked elsewhere internationally with some of our colleagues who are in Australia and New Zealand, and they have done extensive work in implementing broad-based school prevention programs. And they do have quite a few programs that seem to have worked when they implemented in the classroom. So I wanted to share some of those with you. So this is work that's done by our colleagues in out of the University of Newcastle and the University of Sydney, also University of Auckland. And just earlier, prior to this workshop, we heard from Dr. Grant Christie, who's also talking about some other solutions there. So I'll take some examples and lead this into, how we feel some of these features can be adapted to our shortcut concept. I've listed here also some of the people who are spearheading this work. There are too many to really list in one slide, but they are big teams. They also receive substantial funding from the government and their Department of Health, which is probably another point about broad-based prevention programs, and developing something like this it's very costly and labor intensive and does take many years for them to come up with these solutions. One school-based program is called Climate Schools. And this is from Australia. And this universal online program was developed for high school students and starts quite young. So from 13, so kind of 8th grade, I guess equivalent to our school system. And they start with alcohol. They also introduce cannabis, psychostimulants, and ecstasy. So they don't have an opioid crisis currently, and so they haven't addressed that in their modules, but these are the substances that they've found has been in their schools. So they're addressing this during their in their program. And they have done quite a few RCTs to look at its effectiveness. And this, when you see this, at least when I look at it, 450 schools and over 13,000, at this point, probably upwards of 20,000 students being engaged, is really efforts that needs to be supported by the ministry. right? It's not, of course, a single research team that can apply and work on this. So it's a really concerted effort for everyone to really take this upon them, that they feel this is something that students need. So from 450 schools, they did several effectiveness trials, and they show that it could work. I think one difficulty in sometimes promoting prevention programs, and maybe the difficulty in getting funding for it too, is it's quite difficult to show effectiveness of broad-based prevention programs. As you can imagine, it would take quite long-term longitudinal studies to follow students and see if the youth in fact do have a change in their substance use behavior, either in initiating drug use or developing substance use disorder. It does take a long time to demonstrate that. And I think that's another reason why it's quite difficult to convince funders to support broad-based prevention programs. But it can be done, and there's evidence that shows it works. So I think this can help, can add to us in building our case for shortcut. They've also taken this outside of Australia and implemented it in the UK. And I'll stop here. I see a question from Sarah.
Hi, Fiona. Your slides are so amazing, and we would love to see them a little bit bigger if possible. The way the screen is shared is we can see your presenter notes, so it makes
okay.
it just a little bit crowded, and it's obviously like such helpful information.
Oh yeah, sorry. I didn't know that I had my two. Let's see. Does that help at all?
That's perfect. Thank you so much.
Okay, no problem. Okay, so when they took climate schools out of Australia and implemented it in the UK, they found that it was feasible and also acceptable even for the students there. And they didn't actually do any cultural adaptations. Of course, it was still in English, so they took it as is, implemented there, and was found to be quite well accepted by students and educators as well. They've also incorporated now a mental health component, and they're doing evaluation on that in addition. And now in terms of age, so we've thought about kind of the age range of which these programs could be implemented. So we've been focusing on like the high school period. There's another program that's called Strong and Deadly Futures. They have moved their program to earlier prevention into year 7 and 8, starting in like late elementary school even. And they're combining this with a little bit more storytelling, engaging students in developing skills and also in learning how to develop better interactions with peers. So kind of moving beyond just substance use, but into a little more mental health support and mental health education. And one more example I'll give is SPARX. And the reason why I'm bringing this up is it's quite a well-done program, but one important aspect of prevention programs or online interventions is the question of adherence and the likelihood of people engaging in these programs. So developing a wonderful system is great, but how do you kind of encourage people to follow along and use it? So SPARX was a solution developed out of New Zealand. And with this group, they felt that bringing in a game or gamification would be what would increase adherence. And they found it was true that youth definitely enjoyed the fact that they were not reading text or even comics, but they were playing a video game. And this video game is purely for mental health support. So they base it on like a fantasy game that the guide leading you through this quest in this world is your virtual therapist, and providing CBT based tools in order to help someone deal with their anxiety and depression. So SPARX is for mental health support, and they don't have, any substance use components or any risk of addiction, or they don't mention substances there. But it's a very well-made system, and that made us kind of consider also incorporating some gamification into our shortcut concept. Okay, so moving back to Canada and maybe some solutions that have developed here. We have Wellness Together Canada that some of you probably know about. So it's a national program to support mental health. And they also address substance use and manage substance use. They have a small kind of youth trajectory or domain as well. And they partner with the Kids Help Phone. And this Kids Help Phone is another program that's a nationwide program that provides 24/7 counselor support. So you can call in or you can text for counseling support. But I think one aspect of this program and also in their partnership with Kids Help Phone is it doesn't quite follow the person through their journey. So it's a lot of information that is available online. You can get immediate support, but it wouldn't be a continual kind of tracking of your progress and kind of going through building a lot of resilience and skills for the youth. These are examples of the different tools that they link to. So Wellness Canada doesn't provide all those different pieces. They link out to various other programs that have been developed. And so the individual can then sign on and use those. Okay, so this brings me to the next part, which is how we had developed the risk assessment and management platform. So RAMP is a program that Michael has spearheaded and is developed with funding from Health Canada. And this is not for youth. This was developed for adults as assessing opioid overdose risk and to manage that risk through informed decision making, through assessment of your risks and goal setting, and then through that to prevent risk, manage that, and hopefully move into recovery. And it's a cyclical process, of course. And there's a screenshot on the side of what RAMP looks like, and you may have heard some presentations about RAMP previously. But this was kind of the springboard for where we then are moving into the concept for youth. Now through RAMP, we have been looking at how different technologies and AI technologies can be used to assess risk, and how RAMP can be sort of a live learning system that as users are inputting their information, are going through the modules and then reassessing their risk, that this is a kind of a smart system that is learning that and being able to apply it then to the next user. So over time, it's kind of becoming a little more tailored and can be more personalized. And this is what we're hoping also for the shortcut concept for youth. So this is a concept and model for how RAMP works. And so the shortcut concept for youth would follow a kind of a similar approach with all these different pieces that then are integrated together to create the solution. So the green is the overall engagement platform and the first sign in with like a lot of videos and introduction. And then the pink there, we have the screening, there's assessment, and then the individual can then choose after they do the assessment and certain high risk behaviors or factors are identified, they can then set their own goals. And so they kind of have their own kind of liberty to decide how they want to engage with the platform, which risks they would like to address, and how they want to go about that. And then the platform is able to help them manage and monitor that risk. And that would be the continual engagement piece. And then in the blue there is the next level where RAMP is able to provide some navigation of healthcare availability and what are the different options that a person can access. And they also have daily reminders. You can structure the daily kind of activities and behaviors, as well as a diary to keep track of different triggers or different situations that might increase craving. And you can note that and sort of be a little more mindful of what triggers the potential relapse. Then there's also, I think, a quite important component, which is explaining what the overdose risks are and providing information that would be continually updated. I think as we see different trends of substances that are available on the market, that this information needs to be made available for those who are using the substances. Then in the next level, there's a treatment approach, which is using cognitive behavioral therapy to address depression, anxiety, and mental health concerns. There's a life chart piece, which is also helping one understand what is going on in their kind of day-to-day behaviors and what are some triggers. And that links to the symptom diary. Another large piece, because this is assessing and managing opioid risk, is providing options for pain management, because as we understand, that is quite an ongoing and significant component that might be driving the substance use. And then the next level there is managing withdrawal, understanding what are the options for withdrawal, symptoms, how to address that, providing information training on the lock zone, and then also incorporating a peer support and bringing family members or peers into the discussion and into this whole platform, and also options for substitution treatment. And then to bring out that piece about the smart system and how it all interacts is on the common backend, is all these different pieces are feeding into the backend, and that information is kind of relaying to the other parts, kind of knowing if the person is using certain aspects and that's helping, then it would encourage that a little bit more. So there's always that feedback mechanism. So this structure is, the plan is to apply that to the project shortcut for youth. That I said in the beginning, this will be a web-based platform that's for prevention and early intervention for high-risk substance use and overdose. I think a very important piece that we found from looking at other solutions and also from the literature is that social aspect and that peer aspect. So making that a large part of Project Shortcut would be a goal of ours. And helping youth understand their risk awareness and also manage their risk. That's another goal. And of course, providing links to resources and not taking away the importance of in-person interactions, of course, with educators, counselors, with their peers, also with parents and family, of course. So there's both the kind of working in synergy, both online and in person. And under there, I've also included a little information about Walk Along, which is a solution that we've developed for youth to support them in their mental health journey. And this is an online platform as well, more information-based with some CBT tools as well. And so we've used that as kind of a springboard into moving to our shortcut development. All right, so this is quite a full slide with a lot of different pieces that I know Michael has worked very hard at putting in, and he doesn't want to lose any of the different concepts. So I like this graph because I think it pieces together all the different things we've learned from solutions internationally from our colleagues, pieces that we see worked there. And then also new technologies that haven't yet been applied to mental health support and to substance use support, but which is available. And I think we shouldn't lose sight of the fact that if things can move ahead so quickly in e-commerce and other things, we need to make sure that we also capitalize and incorporate that into how we develop solutions for substance use treatment and for support. So I think the shortcut concept can integrate all these different pieces. So on the outside, the white there is kind of all the different, I guess, supporting pieces. So the school prevention programs, we know that implementing it in schools with educators on board is very helpful because that could increase adherence. Giving people a solution that they do at home, especially for youth, might not be as effective in terms of engagement and also follow through. Health links, of course, from people's connection to the health system, also their information in the health system, if that can be incorporated into this program, that would be very helpful and also make the program that much more responsive and personalized. Peer mentoring is another important piece. And then on the other side, we have through the shared health record system, through integration of RAMP and those pieces there. And another piece we've talked about for RAMP is having some AI technology incorporated and natural language processing. So how natural language processing could work in a youth prevention concept is a recognition that social media and the youth use of social media is so prevalent now that based on that, we can use natural language processing techniques to identify earlier on risk factors based on the conversation, based on their personal phenotype of how they're using their phones, and also the conversations and the input there. That can all be taken and adapted and used in this sense, which we know they're already used in other areas of social media and engagement. But I think that that's an opportunity we shouldn't miss on how it can be applied here for substance use support. Okay, at this point, I look at the time, we still have some time that we could have some discussion. So I'll just go through this last slide, which is talking about how our next steps look like and what activities we are planning to put in place in order to kind of make this happen. So we're building partnerships, both from school board partnerships to those who are in kind of more acute care and recognizing like the high risk population and what their needs are. We also, of course, are exploring different funding opportunities. And as I've mentioned, like large broad-based programs, especially if we incorporate gamification, is quite expensive and needs a lot of funding support. So that's something to be worked on. And also the RAMP is allowing us to test a lot of our principles, especially about the AI technologies, the natural language processing, and also building predictive modeling that can be tested through RAMP. And as we implement RAMP and evaluate it, that will provide us with quite a bit of information on how to develop the youth piece and the shortcut concept. We're also, as I said, going to continue to evaluate and validate how this technology is working in a dynamic system and how it could be incorporated. And we are establishing youth participatory research groups and a co-design team to, of course, incorporate the living and lived experience into our solutions. So that brings us to a time for discussion and comments. Would love to hear everyone's comments. I will stop the screen share. Maybe then I could see.
See each other and nobody else here.
Yeah. Oh, I see in the chat now. Sorry that I was sharing the presenter view, but thank you for bringing that up earlier. Do we have any one who's in the audience working on prevention or involved in working with youth at high risk, and what does your solution look like? Or if you want to share your struggles with it, or if you were to see a prevention concept like this, do you have suggestions on how it could be made to work better or implemented? We'd love to hear from you.
For us, we take more of like a client-centered approach. So we base it off what the client's needs are. So I think like having this program fine-tuned to what your client's needs are would make it effective. But again, it's also like the language of it. Like my youth would probably not respond to it too well.
Which aspect of the language do you think would need to be kind of altered for your youth population?
The one that I'm thinking of, for example, they like the common one is like, oh, we do our research. Like all of this doesn't line up kind of thing. So it's sort of like bringing it or bring, like, the challenge is like kind of relaying the information in a way like that'll get them to think about it more.
Mhm. What are some useful strategies that you've adopted with your youth? Do you think like peer support is something that's engaging for them?
For me, like my style is more so like a build, like for us as like a program, relationship building is the biggest part of it. So like we
Mhm.
keep it, I hate this phrase, but we keep it real with them.
Mhm.
Like we're not always just like, oh, we need to do this. Let's get you a job. Let's do resumes every single meeting. It'd be like a bit of a break of like, we do something like that, then do relationship building, like take them to the gym or teach them other life skills like that.
Mhm. Yeah.
And then, sorry, give me 1 second.
Here is a question on the chat, Fiona.
Yes.
From Kelly to everyone. Just thought I would mention Foundry has a fully virtual app up and running. It's a free service that provides counseling, information on substance use, stories of use, ways of connect with services, as well as crisis urgent connections. And Sarah is adding, thank you for all your work, Kelly.
Yes.
At
Thank you for
Foundry.
mentioning that. Yes, I know Foundry has really developed their platform as well, and has a lot of different services to connect. So yes, thank you for adding that.
Fiona, one of
Yeah.
the things I wondered about is rewards. Like
Mhm.
one of the other presentations I listened to, they talked about the number of youth who disconnected and so drop out of use of these kind of resources. And the resources
Mhm.
can be great, but I'm wondering about how to keep people engaged over time, if there's a way that we can provide some positive rewards that keep people coming back.
Yeah, I think that there's probably the type of motivation for individuals are different, right? Everyone is kind of motivated by different aspects. One option, like one piece, is sometimes having peers then become mentors for others. So supporting them in kind of looking at their own risk, building their own resilience, and then them becoming mentors for others could be something that is, rewarding to some. I mean, not everybody is maybe feels reward from becoming a leader in that sense, but for some that might be. I know that in the school-based programs, that's probably a reason why they had good adherence and completion of the program, is because it was done during the class time, right? So pretty much it was like at the counseling class where they went through the material and the teacher led them through discussion, and then they went through like the comics or like the different intervention pieces there. So in that case, it was kind of course completion as the motivator.
May I also comment on existing solutions and how to, so our concept and our idea is really to try to bring together all the, or try to open up and merge existing initiatives. And I know Foundry started a good initiative. We heard from Auckland, the youth-specific platform, great ideas. We heard from Australian colleagues about climate school. But the point is, those are, let's say, covering specific areas, and also they are, so everything, we still don't have really a comprehensive system available, accessible to adolescents and young adults today. And there are also, I don't want to even talk about the gaps, but I think I would like to try to integrate the existing solutions as best as possible and add then what we learn over the next years to it, and provide an integrated tool which is fun to use, which is also starting with prevention in schools, which means, let's say, normally developing and functioning youth, trying to not only limit it to kids with specific problems, mental health problems, or street entrenched youth, or whatever. So creating a broader system, and then allowing us to identify kids with high needs earlier to really establish something like an early intervention trajectory. So I would really, so if there is something good out there, I think we should do everything collectively to make it available and use it and learn from it, and then develop the next level together and create as much synergy in this area as possible. So I welcome, I think we're welcoming as a group all the good initiatives there, and we should really make them more public and engaging and whatever. But it's really important to learn from all these great examples. That's the purpose also of this event, right? New Zealand is probably the most advanced in what they're doing, but there are other programs too. The point is, we are in charge here in British Columbia and Canada to make it available, provide it, and adapt it to our specific needs. Yeah.
Mm-hmm.
Anyhow,
Okay.
I think
Do you have any other comments?
I think your presentation was so comprehensive and so good that nobody is really feels encouraged to ask questions.
I don't know, maybe with also presenter notes, right? So everyone already read my mind, so.
Okay.
Okay.
And then let's
Sure,
go.
then we'll wrap it up.
Have a break.
Yeah. Oh, there's Karen wondering what the feedback is from youth and how are you tracking utilization? Yeah, so we're developing this concept now with youth focus groups, going through like a co-creation process. So at this point, we have not developed the shortcut solution yet to utilize and to implement. But when we do, we will be starting with a small pilot group who are using the solution, giving feedback, and then we go back to the drawing board to improve the system. So going through an iterative process to develop the program. And then we will be, for those who are willing to sign up, we will have their accounts and be tracking kind of their use of the platform.
Okay.
Okay.
Then we see each other at 2:45 for the panel.
Yeah. All right. Thank you, everyone. We'll see you in the next session.
Take care.